Hey everyone, here are the coaching call questions that were submitted prior to our February 2nd coaching call, which ended up going a bit over and I didn't have time. So I'm going to catch everyone up on this right now. So the first question is, if the exercises feel good when you do it and it hurts later, is this due to the exercises? Well, that's a good question. Usually, if an exercise is painful, you'll feel that pain from that exercise almost immediately or immediately after. So I'm not sure how long later is that you're talking about. My belief, though, is uh, in most chronic pain, it's due to how you're using your body. So if you have pain later and the exercises felt good at the time, then the later pain is often probably due to the same movement habits that you've been employing that have got you into pain in the first place. So it's telling you that uh, there are still some issues for you to uncover. So what would my suggestions be for that? Well, if you haven't watched the Changing Habits video, that's about changing your habits that are causing pain. And then also the extra help video has taping techniques to help support your body until all of these changes that you're trying to make can occur. Often those taping techniques feel very good almost immediately for a lot of people, and they kind of give a bridge to your body and let everything calm down while you're fixing all the things that you're trying to fix. And then also, if you haven't done the somatics audio lessons, uh, the somatics audio lessons deal with chronic tension that cause pain. So if your pain is coming later after the exercises, it could be that you haven't gone through the somatics yet and and address the neurological tension that it's occurring in patterns in your body that may be feeding this particular vulnerable part of your body. I hope that makes sense. And then, of course, always, uh, boy, it seems fair, and then, of course, the other answer would be, are you actually doing the exercises correctly and really paying attention to your body? So many people, when they do the exercises, they focus on, when I say we want to do 15 reps, they focus on doing 15 reps instead of focusing how they're doing the exercise. So uh, if you can't make 15 reps, don't do 15 reps. Do it only to the point where you can do the exercise correctly. So I've been using these exercises for over 20 years now and my therapist, and I know that they do not cause pain. The only reason that they would cause pain would be that they're done incorrectly, typically, or that they're not really causing pain. It's how you're using your body that's causing pain after the exercise. So I hope that answers your question. Okay, the second question from Karen. Combination of SI and piriformis irritation and pain on just one side seems to be linked to foot pain on that side. Well, Karen, very astute observation. You're probably exactly correct. So ultimately, to solve the SI joint and piriformis irritation, you'll have to address that foot pain issue. So, you're right on target there. Okay, Pat says, is there a specific test that indicates you need to use a night splint? What improves and how long does it usually take? Okay, so what Pat is referring to is a dorsal night splint that I recommend. And what I ask people to do is when people sleep, their foot is pointed away, which causes the calf and soleus complex to become tight. And so this little night splint holds the foot into a neutral position and keeps that from happening and solves a lot of foot and ankle pain. So is there a specific test? Well, if you have chronic foot or ankle pain, it's probably due to the tight calf and soleus complex. I don't take people through tests because, uh, ultimately most people who have chronic pain in these areas have tight calf and soleus muscles. And often when I just ask them, hey, do you have tight calf and soleus muscles? They're all just like, oh yeah. Okay, well, so we don't really need to do a test. You probably already know already. And then what improves and how long does it usually take? Well, that's a good question. So the shortness that is in the calf and soleus could be due to just muscle shortening from sleeping. However, there are a lot of people who are contracting their calf and soleus at night into this shortened position, in which case it'll take longer because we have to break the behavior of contracting your calf and soleus muscles at night. Typically, though, you know, on the shortest, I've seen maybe 5 days, and the longest, usually about 3 weeks if you're consistent. So that's how long it would usually take. Again, of course, it depends on how consistent you are and all that kind of stuff. So a little tip about that dorsal night splint. A lot of people put it on when they go to bed and they wake up the next morning and find that it's kicked across the room and they have no memory of doing that. And so that's telling you that it's too painful for your calf to tolerate for an entire night. So what I would recommend is putting it on the second half of the night. For instance, if you get up to go pee, put it on after you go to the bathroom, and then you'll wake up with a lengthened calf and soleus. If you go to bed with it and you kick it off in the middle of the night, well, then you've lost the benefit of the dorsal night splint by the time morning comes and you get out of bed. So we want to put the benefits of that dorsal night splint as close to as possible to getting out of bed as we can. And then as you get better, you'll be able to wear that longer and longer. So that also factors strongly into how long does it usually take. So, okay. Linda, just curious, where is hip bursitis actually located? And can you show us, please? Okay, so the bursa is here on the outside of the hip. Okay, and so there's an IT band that starts up here that runs over that bursa. And so when the thigh bone is not tracking correctly, it rubs on that IT band often. Also, it could be due to weak hip muscles. And so that all is solved through my program. And so that's where, so the bursitis, itis just means inflammation. So it doesn't say why it's inflamed. So itis can have lots of different reasons for occurring. So anyway, this is in my experience, it's usually coming from a tracking problem in the hip joint. So I hope that answers your question, Linda. All right, Lorita, right-sided SI joint pain, which exercises bring lasting relief? Well, it's a good question. So I'd like to know that too. So Lorita, usually this is the right side. So an SI joint pain, the S is the sacrum, the I is the ilium, and this joint that it forms is the SI joint. Typically, with right-sided SI joint pain, you'll see a right ilium or pelvic bone that's higher than the left side. And you'll also see a rib cage on the right side that's lower than the left side. So there's compression here. What you need to solve, this is easily solved, but what you need to solve is the reason this is happening. The reason this pattern is happening is usually because of some older problem on the same side leg. So just like, let's see, whose question was it? Karen's, who observed that her SI joint and piriformis irritation were just on one side, and it seems to be linked to the foot pain that she has on that same side. She's exactly right, and the same answer goes to you, Lorita, is that you've probably got some older problem on this side that your body is compensated around. This pattern is occurring because your brain is unconsciously trying to get off of whatever problem is here. And so it lifts this up. And you can imagine if that's lifted up, it generates torque through the SI joint area. Now, I'd say it probably 80 to 90% of the cases, it's a same side issue. However, 10 to 20% of the cases, it's a compensation for the opposite side. There's some problem over here that you're not dealing with well. And so your brain, so what you do is you weight bear more on the other side. And when you weight bear more on the other side, and it starts to develop problems. So it could be that the ultimate problem is starting on the left side instead of the right side. So I wish I could answer your question, Lorita, but really it really depends on your history, your exercise history, your work history, your injury history. There's just so many factors here that I can't possibly know. But my program will systematically take you through correcting whatever problems these are. It should help you systematically correct all of these problems. What you're trying to do is correct the asymmetries between the two sides. Okay? Okay, Carol's next. Female left hip pain, tight piriformis, groin pain, and nerve below the knee. Gosh, I think Carol, I talked to you last night on the call. However, so this all of these symptoms have in common the problem that I mentioned earlier of an anterior femoral glide syndrome, where the femur head is sliding forward in the hip socket and causing excessive wear and tear in the hip joint. It causes groin pain in the front. It can cause bursitis on the side. It can cause piriformis syndrome in the back. It can cause what's often diagnosed as arthritis or arthritic pain. So really what it is, it's a tracking issue that is irritating everything in that hip joint area. And I'm pretty sure we talked about this. So we need to solve the reason the tracking is occurring, which is usually because the butt muscle is the primary controller of that hip bone. So usually people who have these kinds of problems, their butt muscle is not working well when they're walking. Why isn't their butt working well when they're walking? Well, it's often because they're locking their knee when they walk, which means that they are standing on their joints and not using their leg muscles and hip muscles instead. And what that does is it turns off the butt muscle, which then causes the thigh bone to start to migrate forward in the hip socket. So hopefully that answers your question. And of course, my program addresses all of that. Okay, Catherine, doing the somatics, I'm learning that I'm stiff all over and have very little awareness of my muscles. How much awareness? Okay, so that kind of trailed off, but I believe I answered Catherine's. Catherine had multiple questions that we answered in the coaching call last night. So if you want to see my answer for all of her questions, then I would just watch that video for the coaching call. Okay, Jeanette's next. I have a side bending issue causing hip pain even after doing the exercises for 2 weeks. Sitting causes the most pain. What to do? Well, Jeanette, I would ask you to reverse your thinking on this, first of all. Is the side bending isn't likely causing the hip pain. The hip pain is causing the side bending. So there is a hip issue going on here that's causing your body to compensate in such a way that it develops a side bending pattern. It may only be the hip that's injured, or you may have some older issue that you haven't addressed yet or identified yet, usually on that same side. Uh, I hate to sound like a broken record. Locking the knee is often a big problem because it turns off the all important butt muscles, which correct the tracking issues in the hip socket. So I would look to that. Yeah, and as I mentioned just a little while ago, in 10 to 20% of the cases, you're compensating for some problem on the other side of the body, and you're overloading the painful side, and it's saying, I can't do anymore. All right, especially when sitting. All right, when sitting is when the anterior femoral glide syndrome issue becomes more exacerbated. That's when it seems to glide forward in the hip socket more. And so that may be a clue that you do actually have an anterior femoral glide syndrome. So here would be a little test, and I talked a little bit about this last night, Jeanette, and I can't remember whether you were on the call. This brings up the idea of test and retest. So this is what I use in my clinic all the time to know whether I'm on the right track, and you can use this too to know whether you're on the right track. So Jeanette, you're telling me that when you sit, you have hip pain. So I'm not sure how long you need to sit to have hip pain, and I don't know whether it's every chair that you sit in that you have hip pain or maybe specific chairs. But all of those things are clues as to what's going on, okay? And maybe it's not pain actually when you're sitting, but maybe it's pain when you get up from sitting. So I'm not clear on that, and so I'm just trying to guide you in your thinking about this. So let's say that you have hip pain when you sit for after 5 minutes, okay? And this is consistent, no matter what chair you sit in, or even if it's some special chair that you sit in that you have hip pain. Then you're going to sit in that chair, you're going to test it and see, oh yeah, there's that pain I'm complaining about. And then you're going to, what I would do is get up from the chair, walk around, come back and sit again and see whether that pain, happens again and maybe even sooner. So maybe it's one of those cases where once it's irritated, it stays irritated. I'm not sure. But anyway, what you're going to do is you're going to test that pain, identify it, understand just how long you have to sit before that pain occurs. And if it's a specific chair, sit in that specific chair, and so on and so forth. Then, because my first assumption with any kind of hip pain is that it's a tracking issue in the hip joint, then I would do that butt pump exercise immediately until fatigue and make sure that the butt is doing the lifting of the leg, not the back, not the quad, not the hamstring, not the foot. You're using your butt. Go to fatigue, whatever number of reps that is. do it for 2 sets on that painful side, sit back in your chair and see if that resolves your pain, or you can last, instead of 5 minutes, now you can last 20 minutes before hip pain happens. Well, that's telling you, if there's an improvement, it's telling you that the butt pump is a critical exercise for you to do to solve this. So that's how you do a test retest to understand. And if the butt pump didn't solve it, well, then try the thigh stretch instead, or try the standing hip tube strengthening exercise instead. So try whatever, go through the list of exercises and then retest the pain. And then that will help you drill down onto the specific exercise that's going to help solve your pain. When you understand what that specific exercise is, then you can think about, well, why is that exercise needed to solve my pain? For instance, if it's the butt pump, then it's because you're standing likely with locked knees or not using your glutes adequately when you're walking. That's when the glutes should be used. So anyway, that's a long answer. Hopefully you got what you needed out of that. Okay, Emma, I have been doing the back and knee exercises for about 4 days. Okay, the pain in my back is better, but my knee pain persists. Well, what you're really discovering, Emma, is that your back pain is likely being caused by your knee pain. So I would much rather solve a knee pain issue than I would a back pain issue. So again, did you watch the changing habits videos? Have you watched the extra help video? Have you tried the taping techniques? Did you try the practitioner recommendations there? Have you changed your gait sufficiently? Are you unlocking your knees when you're walking? Usually knee pain has a lot to do with things occurring at the hip or the foot, because both of those feed into the knee joint. There's only one muscle in the knee joint that controls the knee joint, and that's a popliteus. So if you haven't massaged that popliteus yet, well, then I would definitely try that, because the popliteus muscle, which is located in the back of the knee, causes the knee to be locked into a rotated position and causes a lot of knee pain. So hopefully that answers that. The knee pain seems to be the cause of the back pain, and the knee pain may be caused by the hip or the foot feeding the knee issue. I'm really not sure, because I don't know your particular issue, but that's how I would typically look at it. And I'm glad your back's feeling better. And that's a really valuable thing for you to learn, is that, oh, okay, gosh, I've been fixing my legs and my back's feeling better. So my back pain is really being caused by my legs. I'll tell you, folks, 99.9% of all back and sciatic and SI joint and whatever pain you have in the lower body system is caused by your legs. So we have to solve it. Even if you have neurological symptoms coming down your leg, why is the neurological symptom happening? Well, you've been told it's because of your back, but why is the back causing this neurological symptom to happen? Because of the legs. The legs are setting everything up to fail. It's this feedback loop. The leg is dysfunctional, therefore it causes the back to be dysfunctional and create these radicular symptoms or nerve symptoms that go down your leg. But saying that, oh, I've got radicular symptoms because of my back issue, is only half the answer. The other half you have to ask is, but why do I even have a back issue? It's because of the legs, almost all the time. Okay. Rosalind, what do you do for chronic neck pain? PRP injections have been recommended. Well, I have a Fixing Your Neck Pain and Headaches program. So I would buy that and follow the recommendations there. So if you do end up, Rosalind, trying that neck pain program, I would encourage you to immediately do the shoulder blade taping recommendation that I have in there, because that will tell you very quickly whether the shoulder girdle system is the stressor for your neck pain and headaches. Okay, Carrie, how do I complete the somatic lessons when certain movements trigger the pain, shoots down the leg? Okay, Carrie, I think we talked to you last night on the call. You had the multiple disc herniations, I think, in your spine. And then the particular somatic lesson that was causing you pain was, I think, 4, which is, I think, the rotation somatics lesson. And so rotation, folks, rotation of the spine, if you have back pain, is the last thing that you should do. So the somatics exercise is designed to be gentle, but really it's your effort into that exercise that determines how gentle that is. And frankly, if it makes you nervous to do any kind of rotation, and it would me if I had disc herniation issues, just skip the rotation somatics, because going into that rotation, so there's something unique about rotation in the spine. Let's just talk about that for just a sec. So there are neutral spinal mechanics that dictate that when we rotate our spine, we also side bend to the opposite direction. So side bending and rotation are occurring simultaneously in the vertebrae. So you can imagine that if you're going through any rotation and that it's also going to be coupled with side bending, it's going to increase compression of the discs. That's why, especially with disc herniation issues, never do rotation. Rotation is one of the last things that you ever want to try to return to when you're dealing with neurological symptoms emanating from the back and sciatic nerve. All right, because they're the most aggressive. It's the most complex movement your spine can achieve. And frankly, I mean, even I uh, avoid rotation whenever possible, and I don't even have a disc issue. I just know that my back has a hard time doing it. So avoid those rotation elements of the somatics. Okay. All right. So that's all the answers I've got for you, folks. Thanks for your great questions. And, please watch the coaching call video last night. A ton of information imparted in that video. So I hope that helps you, as well as the other coaching call videos. And again, thank you for trusting me to help you. And I do think that you're on the right track. So keep it going.